Hello students, today we are going to learn infrared rays. So that is commonly abbreviated as IRR or IR. So IRR or IR, that is universal short form for infrared rays. Many times it is also identified as infrared radiation. So infrared rays, infrared radiation, all these are same. Now, let us start with the introductory part of this infrared radiation or infrared rays. Now, infrared radiation, so it is one type of the superficial heating modality. So we have superficial heating modality and deep heating modality that already we know. Shortwave diathermy, microwave diathermy, all these are deep heating modality. While infrared radiation, okay, so that is superficial heating modality. Ultraviolet rays, paraffin wax bath, all these are superficial heating modality. Now, principle of this particular IR, okay, so that uses radiation for heat transfer. There are three ways of the heat transfer. One is conduction, convection and radiation. So this IR, they are not in any type of the contact with patient, but still they are giving heat to the patient and they don't need any medium also to travel. That's why the principle of heat transfer is radiation in case of infrared rays. Now, these rays, they are nothing but electromagnetic waves only. So they have wavelength of 750 to 4 lakh nanometer and frequency of 4 into 10 raised to 14 hertz to 7.5 into 10 raised to 11 hertz. Now, there is classification of this infrared radiation into three parts: IRA, IRB and IRC. Now, what are the wavelengths for this? So, IRA, it is having wavelength from 770 to 1400 nanometer. So, it is having 2 mm of penetration. So, that is going deeper up to epidermis and dermis. Now, IRB, so it is having wavelength of 1400 to 3000 nanometer. And IRC, so that will be longest in the wavelength, that is ranging from 3000 to 10 lakh nanometer. Now, spectrum, so as we can see, visible spectrum, so that is having VIBGYOR, where the R, it is red, clear. So VIBGYOR, last is R, R means red. Now something below red, so that will be infrared, clear. So now infrared means it is nothing but below red color. Now definitely infrared, it is not part of visible spectrum, so we cannot see this rays of infrared, but it is exactly below this red color. Okay, so it is in where the this visible spectrum ends, our infrared spectrum will start. Now you can see here, these are the instruments used for IR. So they are very simple. This is reflector in which the bulb will be mounted, and this reflector will be mounted on stand, and stand will be adjusted as per requirement. Now, the principle behind this IR production, it is very simple, that any hot body will produce infrared rays. Okay, for example, sun, electric bulb, coal fire or gas fire. Okay, and there are other lots of examples. So in short, what we have to remember is any hot body can produce infrared rays. So if we have any hot object, definitely we will be able to produce IR. Clear? But there should be some scientific and sophisticated way. So here what we are doing, we are heating few elements, okay, and just by heating of these elements we will be able to produce infrared rays, and those will be helpful to our patient. Okay, now sun is the natural source of infrared radiation, so that all we know. Now infrared radiations can also be produced by artificial generators, so that is nothing but man-made type of generators. So in physiotherapy department, whatever the two types of the bulbs are available, or whatever the two types of this instruments they are available, okay, so there one is non-luminous and other is luminous. What is the basic difference between these two? So non-luminous means it will produce purely IR. Luminous means it will be producing visible rays also along with other rays. So luminous means it is bright, okay, like in Hindi or in other language it is known as Tejasvi. So it is producing light also, clear. So luminous means it is producing light. Non-luminous means it is not producing light. Light means visible light, definitely. So non-luminous means it is not producing any visible light, so it is producing only IR. Luminous means it is producing IR as well as visible rays also. Now let us go in detail regarding this non-luminous generator. So non-luminous generators, they are made up of simple type of the element or coil that is on a cylinder of some insulating material like fire clay or porcelain. Fire clay means it is one type of the clay only that will be useful for manufacturing of any ceramic, especially brick. And porcelain itself, it is white ceramic. Now what is the process? So the electric current is passed through the wire. So definitely as per Joule's law, that is H is equal to I square RT, there will be production of heat. Now whatever the heat is produced, okay, that will be producing infrared rays. Why? Because any hot object will emit IR. Clear? And this infrared, those will be transmitted through porcelain. Porcelain means, as I told, it is white ceramic. Now, this porcelain is getting heated, okay, by the method of conduction. Conduction means the nearby object is hot, so this hot object will give heat to nearby or adjacent object. So that nearby object will also be heated. Clear? So just by conduction method, the porcelain will be getting heat. Clear? And in this way, it is also giving few visible rays. But as it is non-luminous generator, we don't need any visible ray. We need only IR. So what is done for that? So to avoid this, the coil is put in fire clay or porcelain or placed behind fire clay. Or sometimes emission of the ray is entirely from fire clay. Okay, so that is commonly painted black, so that visible rays, they are either not coming or very few visible rays they are coming. Okay, so in non-luminous generators, what is actually a mechanism? So the part will be painted black, okay, or that part will be put inside or behind the fire clay. Clear? So that visible spectrums, they are coming less or they are not coming at all. Now this element or coil, okay, so that will be put inside the parabolic or spherical reflector. Okay, so that is nothing but one bulb type of this structure will be put into the parabolic or spherical reflector, and this reflector, it is mounted on a stand, okay, and its position will be adjusted as per requirement for patient's treatment. This is infrared radiation reflector as well as its stand. Now, in another type of the non-luminous generator, instead of fire clay and porcelain, steel tube will be used. Okay, again the mechanism will be remaining same. So electric current will be passed through this coil and the heat is produced, and by this heat production there will be emission of infrared rays. Why? The concept is same. Any hot object will emit infrared rays. What is the disadvantage of this non-luminous generator? So this non-luminous generator takes some time for getting heated. So in this case, we have to keep the machine on 5 to 15 minutes before we want to start the treatment. Now advantage, so it is purely giving infrared rays. Clear? See, advantage and disadvantage, they are two sides of single coin. So there will be advantage also, there will be disadvantage also, depending on our requirement. Okay, we have to choose non-luminous or luminous type of generator. Now coming to luminous generator. So the name itself, it is telling luminous means tejasvi. Okay, it will be producing light. Okay, so here in case of luminous generator, what is there? So luminous generators, they emit infrared, visible as well as few ultraviolet rays also. Okay, so these generators, they are in the form of incandescent lamps or bulbs. Incandescent means they will be emitting light when they are heated. Okay, they will be emitting light when they are heated. Okay, so that is known as incandescent lamp or bulb. Now this types of the lamps or bulb, they will be having wire filament in the glass tube. So whenever you have any bulb in your home, so you can take that bulb and you will be able to see that definitely it will be covered by glass, and inside that glass you will be having filament. So that will be a thin thread like structure you will be able to see. Okay, so there will be wire filament and that will be inside the glass tube. Okay, and surrounding this filament, okay, inside this glass tube, surrounding this filament, you will be having inert gas at low pressure. Okay, so inert means inactive, and that will be stored at low pressure. Clear? So whenever the filament is heated, it will also produce ionization and heating of that particular inert gas. Okay, so, and you will be having light. Now this filament is nothing but it is coil of fine wire, okay, which is made up of tungsten. So what is tungsten? So tungsten will be able to tolerate more amount of the heat, and it is having very low efficient of expansion. Now the tungsten, it is nothing but metal, okay, which is used because it can tolerate repeated heating and cooling. Now this type of the incandescent bulb, incandescent, that already I told you, incandescent means it is nothing but they will be producing light when they are heated. Okay, so they will be usually mounted at the center of parabolic reflector. Okay, and this reflector will be on stand again. Now this luminous generators, they emit electromagnetic waves with the wavelength from 750 to 1500 nanometer. Okay, and maximum proportion of this rays will be falling in the region of 1500 nanometer. Disadvantage of this luminous generator, it is very simple to remember, because it will be emitting infrared, visible as well as ultraviolet rays also. So whenever you are using this luminous generator, you want to give only IR, but other rays, they are also coming. Okay, now advantage, so it requires less time for the production of IR. So the advantage of luminous generator is disadvantage of non-luminous generator. Okay, and disadvantage of luminous generator, it is advantage of non-luminous generator. Clear? So these are opposite to each other. Now the depth of penetration. So for luminous generator, okay, so they will be having a wavelength between 750 to 1500 nanometer, while non-luminous generator, they will be having wavelength between 1500 to 12500 nanometer. Now this luminous generator can penetrate superficial dermis as well as epidermis. So near about 2 millimeter of tissue can be having as a part of depth of penetration. In case of non-luminous generator, it can penetrate epidermis, dermis and subcutaneous tissue also. So that may reach up to 5 to 10 millimeter inside the body. Now this depth of perception, depth of penetration, sorry. So it depends on what? It depends on wavelength as well as nature of material. Clear? So which wavelength you are using, that is also affecting, and what is the material. Okay, so for example, skin, fat, okay, fascia, okay, so all these are different structures. Okay, within same structure also, for example, if I think of only skin, so other like two people will be having different type of the skin. Clear? So that is difference in material of body. Clear? Now what are the physiological effects of infrared radiation? So there will be local rise in tissue temperature. So that is nothing but warmth of flow. So whenever you have any chemical process inside your body, definitely you will be having production of heat. Here infrared radiation will be causing vasodilatation. There will be increased blood flow. Okay, so this increased blood flow will be also responsible for increase in temperature. Directly also it is increasing your temperature, because the heat itself, it is coming as a part of radiation. Clear? It will also accelerate few chemical process that we are going to learn in second point of metabolism. But in short, because of vasodilatation, because of direct radiation, okay, and because of chemical processes inside the body accelerated. Clear? So you will be having local rise of tissue temperature. Now increase in metabolism. So by increase in anabolism and catabolism of our body, the metabolism, okay, so that is nothing but product of this anabolism and catabolism, so that will increase. Okay, so that is nothing but again it is want of low. Then comes vasodilatation. So vasodilatation means the arteries will expand. Okay, so because of IR, arteries will expand and there will be increased blood flow. Okay, and that will be very good, because this increased blood flow will bring many nutrients, oxygen, amino acid, antibodies. Okay, so that will be helpful. So physiological effect of IR is vasodilatation. Then stimulation of the sensory nerves. So as the IR is producing heat, definitely the temperature sensations will be stimulated, and this heat type sensation will be having soothing effect on the nervous system. So many times when you give IR in your clinic, so many times the patients will sleep also, because it is having sedative effect, it is having soothing effect on our nervous system. Effects on muscle. So IR will increase blood supply to the muscle. So because of this increased blood supply, you will be also having relaxation of muscle, and this muscle will be also getting heated. So that will be also one type of the relaxation for muscle. So by both of this way, by increasing blood supply as well as by providing heat, the muscles will be getting relaxation. Destruction of tissue. If the IR is given in a very high dose, so definitely it can cause destruction of the tissue, especially devitalized tissue. So if the patient has already taken X-ray therapy or cobalt therapy, so in that case already there is devitalization of the tissue, and further if the IR is given, definitely it may damage or destruct the tissue. Increased activity of sweat glands, not IR but any type of the change in atmosphere or any type of the change in body that increases temperature, whether it is room temperature, whether it is your body temperature. So definitely to maintain homeostasis, your sweat glands will be activated and you will be having perspiration. Clear? So here also in case of IR, you will be having perspiration. Why? That is because of increased activity of sweat glands. Pigmentation of the skin occurs because of exposure to IR. Okay, skin will become, to some extent it will become thick. Now, therapeutic effects. So how it will be useful in therapy? So first it is in relieving pain. So infrared radiations, they are highly effective in relieving pain, not as compared to shortwave diathermy and microwave diathermy. Okay, they are not in that much effectiveness, but still they are effective. Okay, so mild hitting on the superficial tissues, what they are doing, they are causing sedative effects on sensory nerve endings. That's why, as I told many times, the patient will be sleeping while taking this IR therapy. And most of the time it is the pain that is because of accumulation of waste metabolites. Clear? That is nothing but lactic acid. Now whenever you give this infrared radiation, there will be vasodilatation, and this vasodilatation will bring new blood and will drain the old blood. So this old blood is having waste metabolites. Clear? So those will be removed, and definitely because of this, patient will be having pain relief. Now if there is pain because of acute inflammation or recent injury, so that will be most effectively relieved by mild heating. But again, initially 2-3 days it is not advisable to give any type of the heat therapy. You can think of cryotherapy. Cryotherapy will be better for first 2-3 days, but after that you can think of infrared radiation or any other heating modality. Now, whenever the pain is because of chronic injury, you need to give stronger heating. Okay, so in that case, you may need to give this IR therapy ranging from 20 to 30 minutes. Now, in muscle relaxation, so already we discussed that relaxation of the muscle, it is because of heating of tissue. Clear? Now, generally mild heating by this infrared radiation will be causing muscle relaxation. Okay, and if lack of muscle relaxation is responsible for pain, so here the relaxation will give pain relief. Clear? So in this way also, by providing muscle relaxation, patient will be also having indirectly benefit of pain relief. Now actually what is happening, many times after injury or inflammation there will be muscle spasm. Okay, and this muscle spasm will be relieved by IR. So definitely whatever the pain was produced because of inflammation or because of the spasm, okay, after any injury, okay, after any trauma, so that will be relieved by IR therapy. So what is mentioned, relief of the pain that induces relaxation in the muscle and helps relieving muscle spasm. So muscle spasm is painful. Okay, IR is relieving muscle spasm. So again the IR is giving pain relief also. Okay, And when this muscle spasm occurs, so that is during injury or inflammation. So actually what is happening here, injury or inflammation will lead to spasm. Okay, spasm means it is lack of relaxation, it is continuous contraction of muscle. So as a second therapeutic effect of providing muscle relaxation, the spasm will be relieved. Okay, so definitely spasm was responsible for pain. So now the spasm is relaxed. Okay, so it is relieved. So you will be having pain relief. Now, relaxation of the muscle, it is also having advantage on exercise. Okay, so the patient will be able to perform more range of motion exercise. With greater range of motion exercise, patient can perform activity. Now, increasing blood supply, so that is again the same thing. You will be having increase in temperature in the superficial tissue. This increase in temperature will cause vasodilatation. Now definitely if there is vasodilatation, you will be having more white blood cells and fresh nutrients to that area. Now it is also accelerating the removal of the waste products. Okay, so definitely the new blood it is coming, so to provide space to this new blood, the old blood with waste metabolites, they will be drained. Clear? So this will be beneficial in various treatments, okay, of arthritic condition. Arthritic condition, mostly it is affecting our knee joint. Okay, and our knee is caught with inflammation as well as stiffness. So by this increased blood supply, by removal of the waste metabolites, you will be having beneficial effect on your knee joint, especially that is caught in arthritic part. Now many times after immobilization, okay, in plaster of Paris or after surgery, okay, so stiffness whatever it occurs, that can also be relieved by IRR. Okay, open wounds and infection, they can also be treated with IR. Now effects on joint stiffness. So stiffness that we know, so we need more resistance to move the joint. So here because of increased blood flow and muscle relaxation, there is reduction in joint stiffness and there will be improvement in range of motion. Clear? So increased blood flow as well as muscle relaxation, both are responsible for decreasing joint stiffness and providing greater range of motion. Now effects on skin lesions. So definitely in case of skin infections like dermatitis or viral infection caused by any organism or bacterial infection, IRR can definitely destroy the bacteria as well as it will be helpful in viral infection also. Now, which are the indications? Indications means in which condition IR can be given. So it can be given in subacute or chronic inflammatory conditions. For example, low back pain, cervical spondylosis, osteoarthritis and rheumatoid arthritis. Now, back pain you all know. Cervical spondylosis means it is degenerative change, age-related change in cervical spine. Osteoarthritis means it is inflammation of synovial joint, and generally the osteoarthritis in Indian population, it is most commonly affecting knee joint. And rheumatoid arthritis, so that will be affecting multiple joints and that will be having symmetrical distribution, like both the elbows, both knees, back, okay, all these are affected. And in case of rheumatoid arthritis, patient will be having morning stiffness also. Generally it is more common in female as compared to male. Okay, so this all were about subacute or chronic inflammatory conditions such as low back pain, cervical spondylosis, osteoarthritis and rheumatoid arthritis. Now in case of skin infections also, you can give this IR, because this heating will be having destructive effect on bacteria. So the bacteria will be affected or killed by this IR. Then in case of pressure sores and decubitus ulcer, you need to increase blood supply for proper healing. Okay, so in that case also, to increase blood supply for proper healing, you can think of infrared radiation. In case of Bell's palsy, it is very popular treatment. Whenever the patient comes with Bell's palsy, IR will be given. Generally the 10 days for first 7 days. Okay, so it will be increasing blood supply. Now in case of peripheral nerve injury, whenever you want to give electrical stimulation, so many clinicians they prefer to give IR before starting electrical stimulation. So that will be having good muscle relaxation. Prior to any soft tissue mobilization, it may be stretching, massage, mobilization, traction, and electrical stimulation. Before we go for all this soft tissue manipulations, IR can be given initially for proper muscle relaxation. So your manual therapy will be more effective because of this muscle relaxation. Now, which are the contraindications? Contraindications means in these conditions we are not supposed to give. Clear? So, which are this? Acute skin disease. So, in acute skin disease, there are chances that inflammation is still going on, and because of this IR, the inflammation may be worsened. But in case of subacute or chronic, you can think even if there is inflammation. Peripheral vascular disease. So here it is possible that the tissues, they are not in capacity to tolerate vasodilatation, okay, and it may damage the blood vessels. Or sometimes it is also possible that by increased blood supply, okay, you will be having dislodgement of any thrombus, and that thrombus may go into the systemic circulation and may block any artery. Hemorrhagic condition. So here already there is rupture in the blood vessel, and with IR there will be vasodilatation, and that vasodilatation will lead to further bleeding. Okay, so in case of hemorrhagic condition, that is condition of break on this blood vessels, it is not advisable to give IR, okay, because it produces vasodilatation and further bleeding. Now, areas with impaired thermal sensation. So it is very simple logic that if the patient is not able to identify the temperature, definitely if the more heating occurs, patient will not be able to identify, and there are chances of damage to skin. Impaired cognition. So that is also the same thing. Cognition affected means the patient will not be able to tell you exact feedback that whether he is feeling heat more or less. Okay, so again there are chances of getting burns. Impaired communication. So again the same thing, you will not be getting feedback regarding what is the feeling of your patient, whether the patient is feeling more heat or less heat. Recently radiated tissues. So if the patient has already taken radiotherapy, so there will be devitalization of the tissue, and that devitalized tissue may be responsible for more destruction in the particular part to be treated. Over the areas of scar, the skin resistance will be less, so there are chances of burns. In case of severe edema, edema means there is accumulation of fluid inside this interstitial spaces. Clear? So in case of edema, whatever the fluid is collected in interstitial spaces, they will be heated, okay, and it is possible that it may rupture the skin also, because in case of edema the skin will be very thin. Clear? So here the fluid collected will be heated more, and there are chances of rupture of skin. In the region of suspected malignant tumor, definitely if we give heat, so tumor will increase in metabolism and increase in growth also. So it is not advisable, as well as it may spread to other areas. Okay, so it is not advisable to give IR therapy to a patient with malignant tumor. Now, what are the advantages? So IR therapy, it is highly cost effective, because whatever the bulbs we are using in clinical setup, those are not those costly as other machines like microwave diathermy, EMG, NCV machines, they are coming. So IR is very economical, one type of the instrument. It is easy to use at home also, because nowadays portable small IR bulbs, they are also available. Now IR is giving dry heat, okay. Moist pack is giving wet heat or moist heat. The name itself it is telling moist pack, okay. So that is giving moist heat, okay, or wet heat. But here IR it is giving dry heat. So you feel more comfortable in winter also with this. Now this IR can be used to treat larger areas, okay, with local superficial heating effects. Like you can think of shoulder, back, all these are larger area of the body. So those can be treated in a better way. Now by IR the superficial temperature can be increased, okay, but your core temperature will not increase. So whenever you are giving IR to the back, so when you touch the back, so definitely you will feel more temperature on the back. But if you measure the core temperature from anal canal or below the tongue or from the axilla by any thermometer, so the core temperature will not increase. So it is not worsening the any mechanism, okay, for temperature balance, okay, for homeostasis. So even though the locally there will be heat production, there are no chance that overall temperature of the body will increase and patient may be caught in fever, okay. So there are no chance of it. Now what are the disadvantages? So disadvantage, it is uneven body part. So whenever it is uneven body part, so proper distribution of the heat will not be possible. Here in most of the IR bulbs there will not be any intensity knob, okay, and there is no option of pulse, like whatever we have option of pulse in shortwave diathermy as well as ultrasound. Pulse means it is coming at regular interval, so there will be on and off period, but here it is coming with constant intensity, so definitely there are chances of burns. And research wise it has lack of therapeutic evidences. Now this IR is having a less penetration depth, so minimum is 2 millimeter and maximum is 10 millimeter. So it is not as effective as moist pack and paraffin wax bath they are. Now precautions. So what are these precautions? So IR cannot be given or should not be given for more than 30 minutes. Now whatever the distance you are putting between the source of lamp, okay, and the patient, that should not be less than 18 inches. But nowadays frankly speaking the small IR bulbs, they are kept quite near to patient's body, okay. But when you think of this large size bulb, definitely you should put at least 18 inches, okay. Ask the patient not to touch IR lamp because it will be very hot, as well as don't touch any wire also, otherwise there are chances that patient may receive electric shock. Ask the patient not to sleep. Why? Because there are chances that patient may be having sleepy type of the mood. Why? Because IR is giving soothing effect on your nervous system. So in between you can keep your patient engaged in talking, okay, but anyhow the patient should not sleep, because many times it is also happening that patient is moving towards bulb. That is also not advisable. If the people with sensitive skins they are coming, definitely you should take extra precaution. For example, the patient is having diabetic neuropathy, so the sensations will be affected, they will be more sensitive, clear. So there are chances of burns with this infrared radiation. Now IR should not be directly applied to eyes and genitals, okay, because they are having adverse effect. So eyes should be covered properly, as well as definitely it should not be in the near part of genitals. Now burns. So the IR lamp may be causing superficial heat burns, okay. Erythema may happen, so that is one of the physiological effect. Erythema means it is reddening of the skin, that you can see in this figure also, okay. But many times it is causing burns, many times it is just causing erythema, and sometimes it is causing blister. Blister means very small sacules will be produced. Now why these burns they are occurring? So very simple example, intensity is very high, so definitely the heat will be produced more, okay. Sometimes the intensity is okay, but the patient's sensations they are affected, so the patient will be feeling less, okay. So he will not be able to give exact feedback to therapist, okay, and patient will be insisting to increase intensity more, okay. So sensations will lead to increase in intensity, so that will be patient motivated increased intensity. Then patient fails to report overheating. Many times it happens in case of reduced sensation. Unconscious patient, so definitely he will not be able to give feedback whether he is feeling more or less heat. Sometimes the patient moves closer to the lamp, So as per inverse square law, we know that as the distance between particular object and point of the source will decrease, okay, so definitely the intensity will increase. Okay, so we all know the inverse square law. As the distance decreases, intensity felt will be increasing, okay, or the surface area wise intensity will increase. Many times the patient is sleeping during the treatment. So all these are the factors those may be responsible for overheating of the part, and there are chances of burns. Now, many times if the patient is over smart and touches any wire, so there are chances that current will enter into his body, okay, and he will be part of the circuit. So he will be getting electric shock. So what is electric shock? It is nothing but painful stimulation of sensory and motor nerves. Clear? So it is advisable that you give instruction to the patient not to touch any part of the machine, and even we are also not supposed to touch any switch or any other electronic equipment with our wet hands. Now, many times patient may be having faintness or giddiness. So what is actually happening? Excessive radiation, what it will be causing? There will be reduction in blood pressure. So definitely because of low BP, you will be having less blood supply to your brain, and that will give this symptom of faintness and giddiness. Generally, when the patient is in the lying position for 15 minutes, 20 minutes, or even sometimes 30 minutes, so the patient is getting blood supply in horizontal plane only. Now, heart has to pump the blood against gravity when the patient comes into erect position. So initially when the patient was in lying position, the heart was pumping the blood in horizontal plane. But now the patient is coming into the vertical position, maybe sitting or standing. So the heart will have to pump blood against gravity. Then and then it will be reaching to brain. But in many instances, it is possible that heart will take time. So just because heart needs some time, so if the patient is changing position suddenly from lying to sitting or lying to standing, there are chances that patient will be having faintness or giddiness because of lack of or less of blood supply to brain. Many times you will be having headache also, so that is also responsible uh, because of this IR only. Now gangrene, so many times the patient is not capable because of peripheral vascular disease. So whatever the vasodilatation is required, that will not be coped by body, and it may lead to gangrene. Gangrene means the loss of blood supply to distal areas mostly, and the amputation is the only treatment for this gangrene. So in the patients with peripheral vascular disease, it is advisable not to give this infrared radiation. Why? So the reason, it is very simple. This affected or diseased blood vessels will not be able to cope up with demand of vasodilatation. Injury to eyes, so most commonly whenever the eye they are going into the eyes, there are chances of development of cataract. So it is advisable to cover the eyes whenever the IR treatment is given. Now, methods of application, so it has different titles. So which are the equipments required? So there is list: luminous generator, non-luminous generator, so any one of these two. Then you need goggles, so infrared opaque goggles to cover your eyes. Then you need inch tape, so that is nothing but flexible measure tape. Clear? Non-stretchable flexible measure tape. So that will be useful to measure the distance from patient's body to IR lamp. And you also need dry towel, okay, to cover the body parts those are not getting treated. Okay, and you also need moist towels, those are used to cover the area to be treated. Okay, so if there is excessive heat, many times it is not directly affecting your skin, it is passing from these towels. And you need ground fault interrupter, so that is nothing but earthing type of mechanism. Okay, so if you have any problem or excessive current comes, so instead of damaging to bulb, it currents enters into earth. Preparation of patient, So the patient should be definitely in comfortable position. You should check the skin sensation with eyes closed. Okay, and you also compare this sensation to the normal part also. So for example, if you want to treat the knee joint, so check the sensation on the knee joint and also compare the sensation with opposite knee joint. Clear? So if the patient is having hypoesthesia also, you will be able to identify. Now, generally whatever the IR is producing heat, so that heat is not measured. Okay, and in many of the this machines also in IR lamps, you will not be having intensity knob. So in that case, the patient himself or herself, they are the only guide those can tell us that whether we should increase or decrease the heating. Clear? Increase and decrease in heating, that is also by the use of inverse square law. Okay, by decreasing or increasing the distance. Clear? So it is very important that the patient should be cooperative to provide feedback. Otherwise, therapist cannot measure this heat. Okay, so in this hypersensitive and hyposensitive patients, it is not advisable to use this infrared radiation. Okay, what we should do, so first of all, whatever the treatment area you have decided, clean that area. Okay, so that area should be free from sweat, dirt or oil. Clear? And it is not advisable to wear any jewelry whenever you are taking infrared rays. Okay, now whatever the areas those are not to be treated, they should be covered with cloth or bed sheet. Now preparation of the infrared unit, it is very simple. What type of the infrared generator you want to use based on treatment area and condition, you decide first. Okay, then warm up the lamp if necessary. So in case of non-luminous lamp, you should start that lamp 5-10 minutes before treatment actually starts. Now treatment principles we have to always consider. So this light, okay, it should be 50 to 75 centimeter away from the patient's body. So the patient should be positioned 50 to 75 centimeter from IR lamp. But again, this is for stand mounted infrared bulbs, because few small bulbs, portable bulbs, they are also available. So these bulbs, they are kept quite near to patient's skin. Now intensity may be adjusted by moving the lamp either towards the patient or away from the patient. But nowadays few machines, they are having intensity knob, but most of the machines of IR, they are not having intensity knob. So you need to adjust distance only for increasing or decreasing heat. Treatment time should be 15 to 20 minutes. In case of chronic cases, it may require up to 30 minutes also. Adjust the angle of the lamp in such a way that there will be energy strike at right angle to tissue. So that is nothing but use of the cosine law. Clear? So your lamp should be perpendicular to the tissue to be heated. Now at different intervals, okay, after every few minutes, we should check any type of the mottling means reddening of the skin. Clear? So that we can prevent the burns if we see the mottling. So just by this warning sign, we can switch off the bulb. Okay, now the areas those are not treated must be covered or must be protected, that already we discussed. Instruct the patient to call for any assistance. Okay, so if the patient is feeling more heat, definitely the patient should call us to reduce the intensity. Face should be covered, but if the face itself it is given treatment with IR, like in case of Bell's palsy, so at least eyes should be covered. Any question? Thank you.